this afternoon on, well, I suppose it's different all over the world, on lockdown in South Africa, and I wrote on addiction, Christian spirituality, and mental health. This is a recently published article, obviously being from COVID-19. Just to give you a little bit of background, I am actually a clinical psychologist from Pretoria in South Africa. I've been working as a group facilitator in a dual diagnosis unit and have been busy doing my PhD through the University of South Africa. So my PhD is actually on experienced spirituality in mental health intervention for addiction recovery. But the origins of this article particularly was because COVID-19 lockdown was announced in March. The legislation in this country included the prohibition of the sale and transportation of alcohol and cigarettes also here. And I was just interested in what was the impact of this legislation going to have on those in addiction and recovery. And so the article developed because I'd been previously involved in a lot of recovery groups, but face-to-face, I started to become involved in the implementation and facilitation of online recovery groups, and still promoted connection using these faith-based communities, but trying to just see how it can work in the face of social isolation and social distancing. My article focused a lot on the global pandemic and how politics and health were influencing and impacting on different legislation. The lockdown was one of the strictest enforced worldwide in South Africa, outside of China, and the implementation of the lockdown for purposes of healthcare gave perceived credibility to South Africa at the time within the global political arena, where threatening disease running rampant, could easily be perceived and propagated as some kind of governance failure. So a lot it was looked at as COVID-19 is very likely and has been contributing to the reshaping of the global order by triggering distancing between major actors. And we saw that straight away in South Africa. There were accusations against China and how we saw China delivering medical supplies to our country, and also with the halting of funding to the WHO at some point in April. It obviously had an impact on African countries because of our healthcare systems being dependent on that funding. So the complexities of COVID-19 in world politics, as the shifts in the prevailing balance of power became more and more apparent, I was just interested in how Al-Tola actually says the epidemic becomes only one symptom of a dangerous and more acute political dis-ease, where governments vie for the recognition and power globally in the face of this very contagious disease. And so mental health care was directly impacted on with the implementation of change legislation, and the dis-ease within politics therefore inadvertently affected our mental health strategies and interventions and the way that we work. I also looked a lot at the idea of health because of lockdown and isolation. Kaylee had written an article last year also which spoke on the work of Ivan Illich, who, I don't know if any of you know, he wrote Medical Nemesis in 1976 and spoke a lot at that time on the ideas of health and medicine and well-being. And he was concerned already about the possibility of a second watershed in medicine where there might be more harm than good. And he called this iatrogenesis, where the counterproductive effects of too much medicine might start to affect the world. He was also very involved in looking at the cultural understanding of pain and sickness and death, and how each of our culture gives us the myth, the rituals, the taboos, the ethical standards of how we deal with life, how we deal with pain. And he was concerned that contemporary medicine has a whole new set of goals. You know, we kill pain, we eliminate sickness, and we pursue life at all costs. And for me, I was concerned of what was happening in lockdown, especially at the cost of people in addiction, people who all these contemporary social organizations were enlisting major institutions, medical agencies, international relief, all the ideological bureaucracies were all waging war against tolerating and finding ways of working against the sickness and death. And as Kaylee reiterated, this global crisis of COVID-19 was very much based on risk curves and population predictions, and not necessarily on individual stories. So danger was emphasized. People became fearful of the risk curve and the uncertainty of what was going to happen. And legislation was implemented in accordance with that risk curve. Not always, I don't think, especially with those in addiction, to the benefit of the personal story of everybody. And so Kaylee also acknowledged the crisis. Of course, there was a crisis, but warns that at present, this was last year, the crisis was maybe holding some people hostage in very enclosed systems. So as a mental health professional, particularly involved with addiction, I just thought about how are people being locked down within systems and patterns of behavior. And thought about especially the addicts. What is going to happen when people with addiction, alcohol, drugs, gambling, all the online addictions, engaging in the pornography, online dysfunctional love relationships, video gaming, so many television viewing even. What was going to happen to these people when isolated? All limited access, to their available resources had been taken away from support to families, and so their social fear and tension just increased. Now, if we look at work by Alexander, who spoke on the globalization of addiction, he focuses on three aspects. Firstly, that psychosocial integration is a necessity, and we know as psychologists and those involved in mental health that it's that dance between the sense of belonging in community and then our individual freedom and creativity. And he was concerned that this enduring lack of belonging could lead to what he called dislocation. And globalizing free market actually accentuates that. And of course, lockdown, in the sense I was concerned, also was accentuating that, where people might be isolated. And Alexander speaks about this sustained dislocation. Actually, that addiction sometimes becomes a way of trying to cope, in inverted commas, with sustained dislocation. So where the emotional distress and anguish of continued dislocation results in some people not being able to adapt functionally, that the addiction itself becomes the substitute behavior. And obviously there's other theories too that address this. There's attachment theories and interpersonal neurobiology theories that show us that we are humans and we're wired to connect. And the brain is a social organ built by experience. Kozolina tells us that fortunately we can actually adapt. The brain can adapt and survive these difficult challenges, including something unexpected like COVID-19. But because of attachment and these theories, it also implies that if we are placed into hurtful environments or pathological environments, which I suppose in all the countries, but particularly in South Africa, a lot of homes are not safe environments, and people were placed in isolation within these homes, that people can actually adapt negatively, and that this negative attachment, Morgan speaks that addiction can be viewed as a disorder of attachment, where the bonding becomes to a substance or a behavior. And that substance or behavior supposedly then fulfills the reward circuit and gives us comfort and alleviates pain. But of course, my concern was if people who are already struggling with addiction are in these lonely, isolated, and withdrawn places, how is that addiction not going to be exacerbated? Especially in South Africa, I just want to spend a few minutes just looking at lockdown, particularly in this context, and I'm sure it links to a lot of contexts worldwide. We have a very complex socio-political history where there's been a lot of rural and urban migration. In the past, fathers were sent away from their homes, and homes became single-parent homes, and households and families were broken down. I said break up of households. Also, there's a spiritual attachment in this country very much to rural areas. It is a cultural, it's a very cultural belief system. Dr. Cravenstein, who is a psychologist who's done her PhD in psychology in South Africa, reiterated the notion that if the people of South Africa are innately spiritual, then any mental health intervention should ethically also include spiritual and religious beliefs, as these are historically and intrinsically immersed within the cultural traditions. We also have a lot of other challenges. There's a lot of violence, there's a lot of gangsterism, sexual abuse, drug trafficking, drug abuse, corruption. So a lot of social problems, and now lockdown had been implemented, where, remember, the legislation did not allow for any alcohol or cigarettes at all. So many struggles were going on. We have a national coronavirus command council. There was liquor forums, people involved with tobacco, lots of fighting going on, lots of legal cases, but there was a lot of evidence of illicit trade of substances. 90% survey done, 90% of smokers spoke and agreed and acknowledged that they had been smoking illicit substances and illicit cigarettes. There was a huge increase in depression and anxiety and suicidality calls. We have SADC, which is a depression and anxiety helpline, and the calls went from 600 to 1,400 calls a day. And a lot of this was on substance abuse. So we know that what happens when society is put into some kind of isolation, and addicts particularly, we know that a strong feeling of inclusion is important for enabling an individual to use his capacity for self-regulation in ways that will preserve and promote a sense of self and long-term mental health. But in this time, especially with addicts, where instant gratification is such an important part of life, and it's very difficult to put the instant gratification aside for the benefits of long-term reward, addicts were often, and this is what I heard, just could not be bothered to curb those selfish impulses. It felt as if the uncertainty of the future just didn't deem worthwhile in terms of setting aside and self-regulating and staying aware. It was almost like it was taking too much effort, and obviously there was a lack of accountability as well, lack of structure. Remembering also we know in addiction that there's a lot of research to show that the culture of addiction promotes manipulation, lies, deception, and high risk-taking behavior, fighting against authority. So in this country, obviously the government was seen as the authority that had implemented this harsh lockdown, and a lot of people struggling with addiction were very angry and seemingly went into increased criminal activity. There was lootings in shopping centers and liquor shops. There was also a lot of breaking of curfew, because there was a curfew here. So people would leave their homes and go and try and break into places to get the liquor or to buy the illicit cigarettes. So the criminal activity increased and moral decline. So my question was more and more is, how do we cultivate a culture of recovery and encourage this during lockdown? Because face-to-face recovery I was involved with, and I knew how to run those groups. We know that spirituality and recovery are often seen as going hand in hand. There's a lot of research. Seldom in 2015 did research showing us that positive psychology character strengths like vitality, integrity, humility, forgiveness, kindness, these are all important in part of recovery from addiction, and spirituality too. Alcoholics Anonymous is a well-known organization that speaks of surrendering to a higher power as part of their 12-step program. Tibu speaks also of a spiritual process of surrender. But all of these, Albers, I think his work resonates with me. he says, while the essence of spirituality is grounded in relationship with God, it's the expression of spirituality that is experienced in community. And this was what my concern was, because we lose community in isolation and lockdown. And in recovery from addiction, the importance of community and sense of belonging experienced within that community is exactly what helps to solidify those newly developing aspects of self. So remember, the person has to develop a whole new sense of self, and the shared sense of security, acceptance, sense of value, participation in a group. These are all important aspects of being in recovery. So again, just to look at some of the intercollaborative work and interdisciplinary work that I was involved with, was that taking Christian spirituality. My professor of my PhD is actually the head of theology in one university in the country, and I'm doing my PhD in psychology in another university. So I've been in a very privileged position to work from both sides. But in both, Christian theology speaks of self-mastery, of moral traditions, of the importance of benefiting society and not the self. In positive psychology, we know that self-control is important, and we learn to foster self-control to the benefits of others. And also that there are techniques. We know, we've heard a lot of meditation, and these techniques are important. A lot of them are spiritually based in helping recovering addicts. Dr. Cravenstein, again, has shown that within the South African context, there's a very complicated interface between that social political history that I spoke about and Christianity and mental health. We have a very diverse and cultural population here, but at least in the last consensus, 74% of these people here said they were religious, and of those, about 84% spoke of being Christian. So the reason I'm doing that is because that is in my country, that is the diverse population. My professor had also written a lot on being open. It is the only way to work intercollaboratively and within such diverse cultures is with openness and tolerance. Dr. Cravenstein also spoke that we need humility, we need integrity. There needs to be a constantly teachable spirit, honesty. These are core strengths that we also read about in positive psychology. And there was actually, prior to the lockdown in this country, there was a lot of Christian initiatives and ministries, but one particularly was Project Exodus, which had already started groups, recovery groups all over the country. And as soon as lockdown happened, these groups just stopped, and there was instant response and seeing of the need. And so I was involved with also implementing and facilitating these online groups where up to 34 recovery groups suddenly started appearing online for South Africans. We tried to keep the structure, so every night there were groups run and facilitated by different mental health professionals, coaches, and people from different disciplines that were involved and interested. Obviously, families, community members. We were running groups for supporters. I think what's important, though, is that every individual was able to still share their recovery story and share it now, not only nationally, but even internationally. The lockdown struggles, the struggles around fear of corona and what that was doing to people's struggle with staying clean and staying sober, and what were they doing with their withdrawal from their drugs of choice. This could then now be shared worldwide, which has been a wonderful benefit of working online. Also, for me, I was just interested of how we have, and I've heard a lot of people presenting on this in this Congress, so it's been very interesting, is how the tools that many addicts were forced. I mean, all they had was technology, and all we had for a very long time. So everybody was online. And so porn, gaming, gambling were sort of the people in recovery really fighting against that, and yet we could then use the technology as part of treatment interventions and finding new ways of intervening while still abiding by the laws of the country and also reducing the risk, because COVID-19 at the moment we're in the third wave. That's very hectic. So there has to be a constant awareness of that too. I was just personally very touched and privileged to see that online work can still give people structure. It allows for accountability. It allows for connection. The care, the encouragement, the collaboration was still, if in many instances, actually even more, because it was such a much more broader reach in terms of people who could get to it. So in conclusion, I want us just to know that recovery from addiction, just like addiction itself, is a very unique journey, and recovery too is a very unique journey, but it has to be experienced in community. And so how do we keep community? How do we allow for that to continue, especially in the face of COVID-19? It's just been a privilege for me to be part of this. Ilish, I want to conclude with saying he speaks of health as a virtue that designates a process of adaptation. This is Ivan Ilish that I spoke of earlier. He says it's not a result of instinct, but of an autonomous yet culturally shaped reaction to socially created reality. We're talking about health. It designates the ability to adapt to changing environments like COVID-19, to growing up and aging, to healing when damaged, to suffering, and to the peaceful expectation of death sometimes. It also includes that people take personal responsibility and stay self-aware. But this needs to happen in community. So although physical isolation and social distancing are part of daily living, especially here at this time, the opportunity for connection, community, and care between all the parties involved remains easily accessible through online recovery groups. I just want to say thank you for giving me this opportunity and for this online Congress. If you are interested in reading any more of my article, that is the link. Thank you very much, everybody. Bye.